Hi, my name's Lee Matthews and I'm a physiotherapist, and I work here at Queen's Hospital as part of the pain management team. Today I want to talk to you about strategies that you can do at home to help to turn down the volume on your pain. So in the first of these videos I talked about how pain is a protector, how pain is like a warning system, and when it triggers that pain response it can sometimes be to actual harm or damage occurring. But even the perception of those things, even the thought that we're in danger, can actually trigger the same response there. And this is a useful system because it protects us from damage or injury, and whilst our injuries are healing, it also protects us from further harm. And yet sometimes pain can persist long after an injury is healed. And what we also learn is that pain is a complex interaction between our nerves, our spinal cord, our brain, the thoughts and feelings that we're having at any moment in time, and also interactions with the world around us. So we also learned that over time this system can become a bit too good at sending its signals through this network, and we call this sensitization. So over time our body gets better and better at sending the same signals through, so it takes less and less to provoke the same pain response from happening. And we also learned that things can both turn up and turn down the sensitivity of this danger detection system that we call pain. With longer term pain conditions we do get flare-ups, we get good and bad days, and during a flare-up they'll usually pass if you do the right things. So knowing how our pain detection system works, when we're feeling anxious or distressed about things, it actually heightens that system. It makes it more aware of the pain around you. So when you're having a bad day, try not to panic. Panic and distress will actually make you feel more pain than you would do otherwise. When we're anxious about these things, it will actually turn up the volume on your pain and make the intensity of that pain worse. So when we were learning about that network of nerves that go through our body, we talked about the different nerve endings that are responsible for different things. So alongside those nociceptors that send signals to the brain that can be registered as pain, there's also nerve endings that detect things like heat and cold, pressure, movement, touch. If you're having a bad patch with your pain, regular safe use of things like a hot pack, a cold pack, TENS machines, and lots of other things, like even just rubbing around that area, will stimulate those other nerve endings. All these things have different applications, but stimulating those other nerves will help to block out some of those pain signals. And we also know that keeping gently active can help to keep the dial turned down on your pain. When we're in pain, it's easy to increasingly rely on rest as a strategy, but over time we find that our muscles decondition, our muscles can also develop tightness, weakness, and joints become stiff as well. And when we're less active, it also increases our focus on our pain. So activity at a gentle level is a good thing. You've got distraction, which will help to keep the dial turned down. Also, when we're active doing things we enjoy, seeing people we care about, it will help to release opioids, which is our body's own natural pain relief there. And also you're using muscles and joints in ways that will stimulate those nerve endings, which will help to block out some of those pain signals. Pacing of activity is also really important. Learn to recognise if you're applying an all or nothing principle. Sometimes when we have pain, the temptation is just to try and let's get through this, I'm not going to let it beat me. And unfortunately that can lead to a strategy which we call a boom bust strategy, where you have a good day, you do too much, and then you increasingly end up with several bad days. Pacing is a skill, and it's something that you'll have to apply even on a good or a bad day. What we find is if you pace a little bit better, you don't get so many bad days. And it might be on a good day you have to limit yourself and don't do quite as much, but then if you're not ending up with several bad days there afterwards, then surely that's a good strategy. And we also talked about how there were nerve endings in muscles, joints, tendons and ligaments. Well, we know that when we get people to do regular, gentle daily stretches, it helps to stimulate all those nerve endings as well. By doing that, not only do you help to reduce muscle tension and joint stiffness, but you'll also find that that's stimulating all those other nerve endings that we don't activate when we're resting. They can actually help to reduce the intensity of your pain. So there's lots of benefits to regular daily stretching. And gentle graded exercises can also be really important. We understand that with a long-term pain condition, you tend to do less and less of the things you enjoy, hobbies, activities, socialising. But we know that even with a long-term pain condition like fibromyalgia or low back pain, a gentle daily graded exercise program can help. You might find that you're able to stand longer, do the activities you enjoy for longer before that pain comes on. Medication can also be helpful. Long-term pain conditions tend to use a different group of medications that need to be taken every day to be effective, and sometimes it could take using them for several months to see the benefits of that. Whilst these might not get rid of the pain completely, they might also help to turn down the dial on your pain. And it's also important to recognise and address poor coping strategies. For instance, if we think about things like rest, when you've just sprained an ankle and you know it's just going to take a couple of weeks to get better, rest can be a useful thing. We offload the ligaments and tendons while they're repairing themselves, and slowly we get back to things we want to. With longer term pain conditions, with things like fibromyalgia and low back pain, the temptation might be there to also rely on rest as a strategy. But what we find over much longer periods of time, if we do less, we actually then find it's more of a challenge to do things we want to, and it can actually make the intensity of our pain worse. And with that prolonged rest, we also find you get deconditioning, you get avoidance of tasks, and because of that we become more likely to be depressed and low in mood. So rest might seem like a good strategy, but actually it's not. And this is why these days we'll encourage you to be gently active. You might not do things in the way you used to, but actually keeping yourself involved in tasks can be a really important thing. People sometimes also make the mistake of using alcohol to assist with managing their pain or help with their sleep. We actually know that over time it's not very good for you, but also your quality of sleep is worse when you've had alcohol. So there are sleep strategies that people can sometimes use, but alcohol is not a good coping strategy for managing poor sleep and long-term pain. And that boom-bust approach is also a poor coping strategy. If we look on gym walls, it says things like no pain, no gain. Unfortunately, with longer term pain conditions, you actually find that boom-bust approach can actually make things worse. If you keep on fighting against the pain, if you just try and keep on forcing into things, you tend to find it actually turns up the volume on your pain. So we'd much prefer that you were doing a little and often approach and being a little bit kinder with yourself. Stress, anxiety, depression and anger are all things that turn up the volume on our pain. People experiencing a long-term pain condition often feel a sense of suffering in silence, isolation, low in mood, and sometimes it can even cause depression. It can be helpful to recognise the triggers and have strategies for managing these thoughts and feelings. It might be you've got things in place already, and it can help to speak to a trained professional. For lots of places in the UK, you can even self-refer to your local talking therapy service. And when looking at better managing long-term pain, mindfulness can also be a useful tool. Our brains are often filled with so many thoughts and feelings, especially when we're having a bad day with our pain. So doing a little bit of mindfulness each day can help with not getting caught up with this whirlwind of thoughts and feelings inside of our heads, and helps to bring a sense of calmness. And we could even combine the mindfulness practice with a structured rest position. You could also do things like breathing exercises, but ideally these things need to be done every day, and it does take practice to find the right one for you. So not everyone will respond to the same mindfulness practice, and you might need to have a little look and find out what suits you best. You might not even enjoy doing mindfulness, but if over time it helps to turn down the dial on your pain, it's definitely worth considering it alongside the other things we're talking about here. And try to remain sociable, even if it's just a phone call to a friend on a day that you're struggling with your pain. But make sure that every day you do a little bit of something you enjoy. Remember things like laughter, enjoying an activity, spending time with others, being outdoors. All of those things will stimulate those nerve endings and distract us from our pain. And also they can cause the release of our body's own natural pain relief, our endorphins. And other lifestyle management strategies might also be useful. We know that with longer term pain conditions, that sleep can often be poor. Having sleep strategies in place to provide favourable circumstances for a restful night's sleep can be useful, and we also sometimes consider things like nutrition. So those are just some of the things that you can do to help to turn down the dial on your pain, and also things to recognise that might be inadvertently turning the dial up on your pain. This isn't an exhaustive list, and there's other things out there that can also be of help, but I've tried to focus on the things that you can do at home that are cheap, easy to get hold of or readily available. Even by doing regular stretching and mindfulness and exercise, to begin with, you might actually find an increased level of soreness as you go about tasks slightly differently. Over time, over several months, hopefully you will start to see things improve. And whilst it won't take the pain away completely, it might actually be that you can do tasks a little bit easier, or they're less provocative, or it might actually be that you have fewer bad days. So hang in there, start small, and try and change a few things gently and see where that leads you. And hopefully some of these things will be of benefit.